My name is Lynn Goldman, and I'm the chair of the committee that is organizing this workshop on caffeine in food and dietary supplements examining safety. I want to welcome all of you here in Washington, D.C. to the beginning of the second day of this workshop, and also welcome those who have signed on to the webcast and are with us over the web this morning. Just to briefly review what we're up to here, this is an examination of the science that's involved in safety issues around the use of caffeine in food and dietary supplements. So very broadly, caffeine as an amendment to those. And as a workshop of the Institute of Medicine, this is an effort that was organized by a committee appointed by the Institute of Medicine. And the task that our committee had was to do what we've been doing yesterday and today, which is to find the best scientists that we could in order to elucidate some of the issues that the Food and Drug Administration, which is the sponsor for this workshop, had asked us to review. And at the beginning of the agenda, there are some bullets that outline the statement of task that was given to the Institute of Medicine in terms of holding this workshop. I should mention a couple of things that I think are important in terms of understanding this effort, and one is that unlike a committee of the Academy that might be brought together to develop a consensus report, the report from this workshop will not be a consensus of the members of the organizing committee. Instead, the report will, to the best of our ability, reflect what was actually presented, what was actually said here at the workshop yesterday and today, which means that from this point onward, that the work of this committee will be in the hands of the Institute of Medicine staff and also the speakers who have been generous enough to give their time to come here yesterday and today and give presentations. We are going to move forward this morning with some discussions, but I wanted to briefly let people know what we did in the last day or so. The first day was really about doing an overview of some of the areas that the FDA indicated were of particular interest to them in terms of caffeine and health. One having to do with actual intake and exposure levels to caffeine in the general population, particularly in the United States, safety signals and surveillance of population, particularly as can be determined through reports to poison centers, but also through other means. We had a session that reviewed caffeine effects on the cardiovascular system, and then we had a session that reviewed caffeine effects on the central nervous system, and then we had a panel discussion about behavioral effects of caffeine as those apply to health. Also yesterday, we had a public comment session at which a number of members of the public gave brief comments to help hopefully to illuminate some of the discussions for this workshop. Today we're going to be talking about some of the other compounds that may impact caffeine effects and may be present in some of the same foods and other products that in which caffeine is present. We're going to talk about the use of caffeinated products, and then we're going to have a session that explores safe caffeine exposure levels. We're going to break a little early for lunch. Instead of having a break this morning, we're going to have a session that ends a little bit on the early side for lunch, and then after lunch come back for a discussion about data gaps, and that can hopefully be helpful again to the FDA. So that being said, I'm very pleased that today we are beginning our session with a presentation by Michael Taylor, the Deputy Commissioner for Foods and Veterinary Medicine at the Food and Drug Administration. Mike Taylor is Deputy Commissioner of the FDA. He provides leadership and direction to the Center for Food Safety and Applied Nutrition and the Center for Veterinary Medicine. He works closely with the food-related programs of FDA's Inspection and Compliance arm, the Office of Regulatory Affairs. Mike has really been in the lead in this current era of reforming the nation's food safety system, and is somebody that has a very deep knowledge of many aspects of food and drug regulation, food and drug law. And he's going to give some opening remarks and enlighten us about the context for this effort.